I'm Linda Elseygood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us. This evening I'm joined by Dr. Sarah Zielsdorf from Chicago in the US. Thank you for joining me, Sarah.
Yes, good afternoon.
Before we start and hear about your experience as an LDN prescriber, would you like to tell us your story?
Absolutely. It's a very long, circuitous journey that I had to becoming the person that I am today, especially the doctor that I am today. I'm an only child. I actually was born with a birth defect. My esophagus and trachea were joined together at birth. So I was whisked away from my mother at birth, and I was never breastfed. And I had a feeding tube, and I had a lot of issues. In my first days and weeks, I had pneumonia, and I had to have surgery when I was less than a week old. I was born at 4 pounds. And back in the early 80s, this was a very difficult thing. They didn't think I was going to live, but I pulled through. I had to be hospitalized a lot as a little child, and that was very traumatic. And I always thought that, these doctors, including the female surgeon that operated on me, were heroes. But at the same time, I thought that I could do things better. They never explained what they were going to do. They just shoved a tube down my throat or did this and the other. And I always said, I can do that better. And I remember having a passion to be a doctor from the time I was about 4 years old. I always wanted to be a doctor. And so I was very, very precocious, being the only child. And at the same time, I grew up in a lot of dysfunction, a lot of family trauma. A lot was going on at home. It was not a very happy childhood. I had to grow up way too quick. And I knew that I had to be the best because I didn't grow up with a lot of money. And so I knew that I needed to get a scholarship to go to school to become a doctor. So I was valedictorian of my high school. And I went to Miami University in Ohio for my undergraduate, which I took in microbiology, which I never knew how profound that would be until later. I wanted to be an infectious disease specialist. I got married 3 weeks after undergraduate to the love of my life, very wonderful man. And I went to George Washington to study infectious disease and public health at the George Washington University. I took a master's of science in that and emerging infectious disease, where I studied parasitology and microbiology and foodborne disease with some of the experts in the field that work for our national governing bodies. And after that, I went to Loyola University Chicago, Stritch School of Medicine, for my medical doctor degree. And let me back up to say that I actually got very, very sick in college between my sophomore and junior year. I had a bad virus. As we know now, it probably was Epstein-Barr. And then I had symptoms of hypothyroidism. In the spring of my junior year, I was sleeping during class. I was sleeping between class. I was gaining weight. I was very sick. And they said, okay, yeah, I went to all the best places. I went to Cleveland Clinic. They finally diagnosed me as mild hypothyroidism or subclinical, and they put me on Synthroid. They never talked about diet. They never talked about antibodies. They just put me on the medicine. And, I had periods of doing well and periods of doing not well, which we now know would be signs of a flare of autoimmune disease during times of stress, but I didn't correlate that at the time. I was just in school. And so I had periods of doing well and periods of not doing well. And at that time, I was only on T4 treatment. For a little while, I was on T3 as well. I had one doctor who understood a little more about treatment of thyroid disease. So I went to Loyola, and I fell apart my first year. At Loyola, I had a medical leave of absence. People didn't know what was wrong with me. That I consider one of my first major Hashimoto's flare. I came back and finished medical school, and then proceeded to take a residency in internal medicine, which Loyola has a very, very difficult program. And I was working 80-hour weeks and had my second flare. And at that time, it's the worst I've been through. And at that time, I had, between medical school and the beginning of residency, I had packed on 50 pounds. I got very, very sick. And I had tests that showed that my liver enzymes were elevated and had to have a liver biopsy for my 29th birthday. And that's when I found that there was fibrosis of the liver. And they basically said, you have this, it's not fixable. Maybe you'll get better, maybe you'll get worse. Your liver could fail. Never, ever having made any connection with thyroid, and just kind of let me on my way. And things were so dire and bleak, and my mindset was so poor, and I didn't have any, I sought the best nutritionists at some of the major medical institutions. And the big breaking point was when they looked at me and they said, you should eat these foods. And I said, look, this is what I've been eating all throughout my training, this heart healthy diet of grains and processed foods, and realized that that's what was killing me, and that I had to stop everything. I had to take a medical leave during the middle of my intern year, having a mountain of debt and no way to pay it back if I didn't finish my training. The stress was just incredible, and I couldn't work. I had such terrible brain fog, as we know that happens in autoimmune disease with brain inflammation. With gut inflammation comes brain inflammation, and my brain fog was so severe I couldn't write a note. I couldn't do anything. My whole livelihood was gone. I was in bed. I was very sick, and that's how I found functional medicine. It started with rebuilding myself by learning biochemistry and learning how to fuel my body, and starting to read and also get proper care. And it took almost a year to find someone to put me on the right thyroid medication, and to eat and to move my body properly and to really feed my mitochondria. And I healed. I got better. And I went back and I finished my degree. I mean, I had already had my MD, but I finished my program, my residency. I also was infertile at that time. I didn't have a period for about a year because my whole body was in survival mode, and miraculously, I went back to work. I got pregnant. I had a baby girl in August of 2014, and she's just a miracle. I finished my residency in November of 2015, and I have to say my journey to being an LDN practitioner came with a flare that I had during a very stressful time postpartum, which can happen with Hashimoto's thyroiditis, which I was formally diagnosed with. Finally, after 10 years of improper treatment. And I began LDN in the winter of 2015. And that I really credit to giving me my life back during another flare. And I have not had a major flare since that time. And I have now been working in private practice, coming up on a year anniversary with the Institute for Personal Development in Chicagoland, whereby I practice functional medicine. I am studying now I just sat for my American Board of Internal Medicine. God willing, I passed that. Still waiting on the results. But I am also doing the certification in functional medicine through the Institute for Functional Medicine. And I'll be continuing that work with goals of having my IFM certified practitioner exam to be done in the next year or two. So I'm so thrilled to be living my dream and be listening to patients like myself every day coming through my door, having the same story of feeling betrayed by modern medicine and not listened to, and getting their 15 minutes to just talk and then really not being listened to and just being kind of thrown out the door with no answers. And it really starts, the transformation to healing begins with finding someone to listen to your story and finding someone who really knows how to go about unpacking autoimmune disease, and the fact that it really has to do with every facet of our lives. And it's not just a pill. It's not just a diet. All of these things are pieces to the puzzle, but it's not any one thing. It's really having to change everything in your life, but you can heal. Autoimmune disease is forever. You can put it into remission, but it's not something that you can cure, but it is something that you can heal from. And that is the greatest lesson that I can give when I talk to a patient, because I am an autoimmune disease patient. So I think it's very unique for a physician to have that experience, to bring that to the table, and be very transparent, because doctors are never supposed to be sick. Doctors are never supposed to have a bad day, and because of that, I think there's such a, that's where we've gotten to be so cold and unfeeling. That's how we've then driven our system to not have humans in medicine, and that's really difficult. You really want a doctor who is human, who's not afraid to be human, and that's a real difficult thing.
So for the patients that you are treating, I know you said autoimmune diseases. What diseases have you actually treated so far with LDN?
Hashimoto's is obviously a very large part of my practice. I have patients who have multiple sclerosis, also with irritable bowel and IBD, so inflammatory bowel disease, both Crohn's and ulcerative colitis. I've had some patients with rheumatoid arthritis do very, very well. I've also had a patient with a very, very rare neural voltage gated channel disorder that went to Mayo Clinic. They diagnosed her, and then the person was very excited because he was running doing a clinical trial, but she didn't meet the criteria, so we basically dumped her like a bag of rocks, and she had nowhere to go. So I've treated her. I've had patients who've had a history of cancer. I've had patients who've had unidentifiable connective tissue disorders, many patients that have a whole host of antibodies that, can't be diagnosed with one discrete disease, but have multiple hits for autoimmune markers. Sjogren's, I've had patients with Lyme disease and Graves' disease, the hyperthyroid variety of autoimmune thyroid disease. I'm sure there's many that I'm leaving out, but you name it. I've had ankylosing spondylitis, another. I've had many, many, many patients with many different flavors of autoimmunity.
And have any of those patients told you of any negative side effects?
So it depends on the patient. I've had a few complain of GI upset, whereby we have to lower the dose. I have had patients that have had paradoxical reactions in the first weeks starting it, or when they go to increase on the protocol, of sleeplessness. Of course, I've had patients with the vivid dreams. I tell patients who are taking medical marijuana not to take them at the same time. I've had, I think I've had patients who've had more fatigue with it, and I think I've had a couple rare cases of headache.
And how long would you say, on average, would it take for a patient to notice if LDN is working or not?
I have had patients actually notice better sleep within a few weeks, or less pain within a few weeks. But for most patients, I say that they really need to give it a trial of up to 6 months. Mm-hmm. So anywhere from that, I've had very few that say a few weeks they've noticed a difference, but mostly after they, get up to the higher dose, and I'd say 3-4 months to even 6 months.
So Sarah, you were telling me about LDN and type 1 diabetes. Could you explain that for me?
Yes. Some very exciting things about LDN in general that I was very scratching the surface about why I use, what conditions you can use this for, is that, traditionally in allopathic medical world, we say once a person has a disease that the gland, that produces a hormone has been destroyed, that there's no getting that back. But that dogma is simply not true. And this does not work for every patient, of course, but for some patients, and some patients in my practice I have seen, there are certain conditions that you can either reduce medication or regain function. One of them is type 1 diabetes, which is an autoimmune disease against the islet cells, the beta islet cells of the pancreas. And we see that especially in teenagers, younger people that are affected, that are insulin dependent, that they can reduce their insulin up to even 40%. And that shows that there is endogenous function of those islet cells that are, either being let to work, or, that they are being made to work better with the use of LDN. The other two conditions that I talk about a lot in my practice are with hypo and hyperthyroidism. So for Graves' disease, there is in allopathic medical world, the only way against hyperthyroidism to treat it is to kill the thyroid gland, either by irradiation or taking the thyroid out. And so if I have a patient that's in a grave flare that is clinically hyperthyroid on methimazole, especially on blocking agents, I like to give the patient a trial, as long as they're clinically stable, a trial of low-dose naltrexone to see if we can reduce that autoimmune attack on that receptor, because the autoimmunity, the antibodies are being made to the TSH receptor, which is sending a signal that so that the hormone is perpetually being made by the thyroid. It's not an attack on the thyroid itself. So the thyroid gland itself is okay. And so if we're able to alleviate that autoimmune burden, we can potentially restore normal function. So that's incredibly exciting, and that's a completely different approach than allopathic medicine, which I think is worth doing in conjunction with diet and lifestyle modifications. And then also with hypothyroidism for patients who are medication dependent. There are many, many cases in the literature and cases even in my own practice of people who are able to lower the dose of medication that they're on, or even get off their medication and restore normal thyroid function. So it's a very, very exciting time in the autoimmunity world. To anyone that's suffering from an autoimmune disease, for those of you that really feel like you don't have anybody to support you, nobody's listening to you, your own family dismisses you, that you've been betrayed, I just want to say that there is hope, that you have hope, and that there are communities of people on the internet, even that's so wonderful, that are joining forces from all over the world. Here I am speaking to a person from Europe, from England, and I'm in Chicago, and it's just a very incredible thing to be partnering all around the world, that with all of our voices, one day this is going to be standard of care. This is not right now. We're on the fringes, quote unquote, of medicine. We are in alternative medicine world, but the research is out there, and there are allopathic medical doctors, myself included, that are ardent supporters, and that the research is being done and the science is there for many, many conditions. And you might be called crazy because you're gluten free, or because you practice autoimmune paleo, or some variety of a nutrient dense diet, but the science is catching up, and one day it's going to be there, and you are not crazy. So just keep reaching out, keep asking questions, keep searching for people that can help and to support you, and have love and gratitude for every day that you have. I know that you may be suffering. This disease, autoimmune disease, is not for the faint of heart. It's really difficult. But have hope. You can heal. You can heal.
And what would you say to people in the Chicago area who would like to come and see you? How would they get hold of you?
Right now, we are actually growing. So I have a practice within the Institute for Personal Development, which if you Google it, it's www.ipd.md. That's .md, medical doctor. And you'll see that it's actually a mental health group, and people are perplexed by that. They say, how do you practice internal medicine or functional medicine within a psychiatric group? And I say, that's exactly where I should be, because most of us with autoimmune disease have just been handed an antidepressant and been kind of kicked out by our butts, or being told that we have anxiety, or that nothing is wrong with us, or that we're crazy. And I see actually a lot of internal referrals from other practitioners that patients find out, oh, I've been given this antidepressant, but I actually have an autoimmune disease, and I want to see what she has to say. And it's I think it's very, very important, because at the center of health is our mental, our emotional, and our spiritual health. That's really the center of health. So that's why I am there. There is a general number to call. They're setting up a phone center right now. I have to get in as a new patient. I'm accepting Blue Cross Blue Shield, and that there usually is a couple of months wait, up to 8 weeks, 8 to 10 weeks wait right now to get in as a new patient. But I am also starting a concierge practice that is self-pay, whereby people will actually be called by my medical assistant, and it'll be a much more direct way to get a hold of me.
Mm-hmm. And where are you having your offices? You were telling me you've got 2 at the moment and a third on the horizon.
Correct. Right now I'm in Romeoville, which is south of the city. It's off of 55 South. And then I have an office even further south in Morris, teeny town of Morris, which is a half an hour south of the Romeoville office, off of I-80. And I'm actually looking to have an office in the future in Geneva, which is directly due west of the city. So we're busy times. It's very exciting.
Mm. And you sound as though that your Hashimoto's is behaving itself and you're feeling well, which is
yes,
absolutely amazing. And
yes, for the time being, and every day is a gift. You know, I don't take anything lightly after what I've been through.
And I would say you're in a very good position to understand your patients and be sympathetic and a listening ear. Wonderful. I think we should all have doctors like you. It's amazing. Well, thank you very much for sharing your experience with us.
You're so very welcome. Any way that I can help.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.